how to handle it, caring for you and your patient. This presentation is going to mainly focus on the psychological impact of rescue on you as a rescuer, on you as a caver, and on your patient. While this is one of the more significant and one of the more common injuries that we see, it's one that we really don't talk about very often. So I think that it's really important that we spend some time addressing it. So please know that this class is not meant, or this presentation is not meant to be a class on psychological first aid. It is in no way a substitute for counseling in the event that you feel like that's the right choice for you. It is not any sort of definitive care. So please know that I'm recommending that you seek additional training on psychological first aid and address any psychiatric or mental health conditions that you may suffer or be suspicious that you suffer from. What this is going to be is an opportunity to talk about this. This is not just a problem in caving. This is something all of us as society are dealing with. I know that right now, pretty much everybody has undergone some sort of psychological or stress injury due to COVID and quarantine and the canceling of life for the past year. So it's something that we're all sort of coming to with a common ground in respect to that. As far as rescue situations, we are going to mainly focus on the effects of stress injuries during rescue situations. But please know that this is pretty common throughout all aspects of life, and something that we can, be subject to at any time we are in a stressful or situation that our body deems is dangerous. So the more we talk about the stuff, the more we normalize conversation about it, the easier it is to talk about it, and the more likely we are to resolve those issues. So please know that if you have any questions, I'm here. There are other resources to you, and I'm going to throw up some resources at the end of this presentation as well. All right. So it is important that we talk about this stuff, and it's really important that we start reporting things like stress injuries or psychological injury, because right now most of the studies where they've done large cohorts of people who've undergone trauma together are the military or disaster survivors, like the tsunami in Indonesia, 9/11. Beyond that, there's some studies done on organized teams, like certain fire departments or public service workers in a certain city, but there are not a lot of reports or stats for non-agency people. So it is highly, highly underreported, and pretty much the numbers are drawn from people who self-report, or mostly those who go ahead and seek treatment. Behavioral health conditions incorporate psychological, emotional, social aspects, and they really include things that disrupt a person's ability to maintain their well-being. I know it sounds kind of ambiguous. It includes things like substance abuse, eating disorders, and even the real severe stuff that's more ingrained, like mental health diagnosed things like depression, anxiety disorders, and addictions. So I would argue that none of us are unaffected by this. I think that everybody knows someone who has undergone a traumatic situation and has come out with a stress injury, even if it's not something like post-traumatic stress disorder, which people are pretty familiar with that now. I think that only accounts for maybe 7%. I'm just remembering that statistic from something that I read, of stress injuries or psychological injury compared to the rest of them. So that's on the smaller end. It's less reported. All right, so talking about psychological first aid, like I said, it's something that all of us should come to with a common ground, having gone through quarantine and COVID for the past year. But it is something that I started studying Well, we touched on it in nursing school, but I really started looking at it about 4 years ago when I took over being a campus missioner for my church in the community of Rome. I had 3 colleges that I served. And when I took my first psychological first aid class, I learned that the reason it was important is because suicide rates for people 15 to 24 had gone up 47% since the year 2000. I know that veterans have approximately 22 veterans a day that commit suicide. And that's just the extremes of mental health disorder or, unwellness in our country. So it's important. So we're specifically going to be talking about what stress is and how stress affects us. So stress is going to be that specific response that your body has to anything it perceives as danger. This can be pain. It can be something that you're fearful of. It can be anxiety over presenting after body, which already puts me at a heightened level. Anything that you recognize as danger. So when you perceive that and your body thinks, uh-oh, something here could go terribly wrong, you start to react by releasing different enzymes and hormones and chemicals in your body, corticosteroids, adrenaline, and such, that trigger that fight or flight response. I'm sure all of us have heard of that. I'm going to ask, what are some things that happen in your body? What are some signs that you're undergoing that fight or flight response? Throw those up in the chat. Think about those reactions to your body when you're stressed. And Gretchen, I'm going to ask if you'll relay any of those to me. That would be awesome.
So we've got sweat, increased heart rate.
Those are great, yeah.
Breathing rapidly, loss of thinking straight, a tight throat and chest, an adrenaline response, tunnel vision.
That's right. So those things that happen, your heart rate, your respiratory rate, your blood pressure, they all go up, getting your body ready to run or fight. Your muscles tighten, your senses sharpen, and you know that you even dump sugar from your stored sugar reserves into your blood so that it's more available for you to create energy. It's just really cool what all happens in your body getting ready to do that. Anytime that you are in that unfamiliar situation or in an unplanned stressful situation, those things happen. It may not happen on a grand scale. It may not even be something you actually really notice, but anytime you undergo a stressful situation, those things happen. I would like to remind everybody that you don't actually have to be in the moment for those stressful situations to affect you. So of course, if you have a fall in a cave, you are definitely going to get those reactions, right? That's the protective mechanism that causes that pain response to sort of hold off. So you don't really feel that right in the moment. That's the whole kids don't know they're hurt until you tell them they're hurt. It's because of that adrenaline dump. So they have the ability, anybody that's injured pretty severely has the ability to sort of ignore that for the moment. If the dog barks, please excuse me. I'm borrowing my aunt's apartment. All right. So the other thing is that any of your team members that see some sort of an injury, see some sort of disaster happen, you can register that in your body as, oh crap, that could happen to me. And then you start to get that response or that stress response as well. But you don't even have to be there. I know that my sister, when she hears me talking about caving, she is terrified of small spaces and heights. And just hearing me talking about caving, her heart rate goes up, her respiratory rate goes up, she starts to get anxious, her palms get sweaty, and that's just hearing about it. So that means that even like news articles can affect us. So you don't have to be there. People who are at home waiting to hear how their loved one's doing after a caving accident, they're getting this stress response as well. So it doesn't always have to be something that happens right at that time, right? You could go through a stressful event. You could be party to that stressful event and not think about it. It could happen right at that moment, which is considered to be an acute stress injury. You can have an accumulative stress injury. So, I've gone on 5 or 6 or 7 rescues and it hasn't bothered me. But then all of a sudden, one thing changes, whether it's something that triggers in my head, or maybe there's something about that 7th person that I really identify with. And then all that stress injury from previous that I didn't even know I had comes sort of flooding to the forefront, and I start to exhibit the signs of a psychological injury or a stress injury. There are people that have a time delay, there are people that have a time delayed, meaning that, they don't think about it in the moment, years go by, and then all of a sudden something changes, and something that happened 20 years ago is now having an effect on them. A lot of times you'll see this with like firefighters who have been, rescuing people, seeing all sorts of stuff for years, and then they go to retirement and they start sitting down and thinking about everything that they've seen and done, and now they start having trouble. Now they start having bad dreams and nightmares. So that would be a time delayed stress injury. And then, a lot of times something will happen in your life and that just changes something that has never bothered you before, no problem with it before. Now life is different, and it does. So I know that a lot of times with pediatric nurses, they have no issue for years. And then once they have kids, all of a sudden they do have an issue, and it's difficult for them to take care of pediatric trauma patients. It's just because something in their life has changed, and now they recognize that as something that's dangerous to them. They can identify with it better. So the closer you can identify with that situation, the more likely it is to cause you some injury. So symptoms of psychiatric injury or stress injury that we can look for pretty immediately are any personality changes. So I'm going to ask if anybody knows any of those. Can y'all think of some personality changes that acutely happen? Like, what's been your response to being in quarantine right after you heard about all the COVID stuff that was happening and not being able to do what you normally do, and dealing with the stress of having those lifestyle changes? I know me, for one, I am an avoidance person. I make myself really busy if there's something that I don't want to have to confront. And after I got back from working in the COVID unit in New York, I started knitting hats again and working on my house and doing a whole lot of things trying to avoid that. So that was an avoidance behavior.
So
Gretchen,
we've got some more answers. Loss of motivation, depression, depersonalization, changes in eating habits, low tolerance to stressors, quick to anger, self-isolation, sleep issues, frustration, short temper, stress eating, dark humor.
Yeah, all of those are great. And it's not whether or not, like with dark humor especially, if that's been part of your personality all the time, just because you've undergone a stressful situation, it's probably not an indicator. But if you were always one of those super optimistic, really not that kind of joking around person, and all of a sudden you see your friend or you hear yourself start to have those sorts of jokes and that sense of humor, or you notice somebody who never really drank a lot before that started using alcohol a lot more, or maybe smoking up on the weekends, those are indicators. That grumpy, irritable, withdrawing from stuff you used to really like to do. And this is one that a lot of people don't recognize, but watching TV and Netflix binging can actually be an avoidance behavior. So if you didn't do that a lot before a stressful event, and all of a sudden all you want to do is watch TV after an event, that might be an indicator. Some late signs of a stressful event or a traumatic injury would be those diagnosable things like depression and anxiety, substance addiction, and suicide or suicidal ideations. Undergoing stressful situations and living with this stress long term can cause psychological damage, but it can also cause physiologic problems, gastric disorders, sleep disturbances, fertility problems like erectile dysfunction, erratic menstruation, loss of libido. So it's real important we address these, because I know I don't want to have any of those side effects. Chronic high blood pressure increases your risk of heart attack. There are all sorts of things that can come about if this stuff stays unaddressed. All right, so I think I've driven home that it's really important that we pay attention to this stuff. What I want to talk about is now, how do we start to prevent it? So most of the stuff that we can do to prevent psychological injury or stress injury really has nothing to do with rescue. Most of it has to do with planning ahead and mitigating them before we even get in those situations. So it's like that old saying that your grandmother gave you, an ounce of prevention is worth 2 pounds of cure. I know how many times I heard that. Definitely plan ahead. So I know that y'all talked a good bit with Bonnie about things to do ahead of a situation. And really that's a way to stay out of a problem, right? If you know your gear and you know your plan for how we're going to get to the cave, how we're going to get out of the cave, you know, those pre-planning things, those are great. Not only do those lower your stress level because you have fewer questions in the moment, but if something happens, you've reduced your risk for injury. And that's what the things you can do beforehand are all about. So things you can do to lower your stress level in the moment so that if something goes wrong, you're not starting at an already weakened state. And that's why if you go caving and you're sick, your body is already at a heightened stress level, right? Because you're combating whatever illness it is. And then if you have a problem, now you're adding insult to illness that's already there. So you've further increased your risk of a stress injury or psychological damage. And you see this a lot with newer cavers. So they're in the moment. They're really caught up in going and being there and caving with this new group of people and doing new things. They're unsure of their environment. They're unsure of their techniques. They're unsure of their group. They're having performance anxiety because they really want to impress the group that they're with. And so all of these stressors combine, and then if something happens, they are at a much higher risk of getting a stress injury. So one of the best things that you can do is train, work ahead of time, be comfortable with your equipment, be comfortable with your environment, be comfortable with your team. Having that knowledge base and that familiarity is super important, because then when something goes wrong, it doesn't stress you out when your curl catches your ponytail because you've already practiced with how to get that undone. It's not a big deal, right? It doesn't stress you out. It doesn't cause trauma. It can just be dealt with and move on. You can continue your cave trip and you don't have to dwell on it. Some of the other things that help prevent, and a lot of this is from studies they've done with the military and with first responders, the length of time that you've done something is a protective factor. So if you've been caving for 20 years, you have all these great memories and experiences to draw on. So when something bad happens underground, it's less likely to be harmful to you than, you know, if you're a brand new caver and this is your first experience, and you have a problem. These are some other things that I think are really neat. Perceived favoritism with leadership shows an increased risk of psychological harm during an event. And that's because of lack of trust in leadership. So decreased job satisfaction, all of those things that increase your stress level. If you're complaining about your job or you're complaining about your caving team, then you're already at an increased stress level and your chance of psychological damage in the event that something happens is increased. And one of the things that I was reading about and studying on it, I didn't know this was a thing specifically until I started studying for this, but resiliency training is a real thing. Resiliency is your ability to bounce back after some sort of an event. And resiliency training is a way to reframe your attitude and your outlook, to stop negative thoughts, change that focus to positive thoughts. It works on not just the cognitive and mental stuff, but also the emotional and physical aspects of bouncing back. So calming yourself in the moment, positive behaviors, actual things to like stop yourself from doing negative behaviors that ingrain that stress injury, that help you to process that and move through it. So I definitely recommend that everybody checks out a resiliency training class. I know that I'm going to be looking into that soon. Let's see. focusing on what you can control. And the reason I wrote that down as part of what I thought was neat about resiliency training is that it makes me think of that AA motto, the serenity prayer. God grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. And that's really being able to let go of stuff that you have no control of. Fix the things that you can control, feel positive about those, and then, being able to tell when it's something that you can have an effect on or not. So I thought that was really cool. And then talking about psychological first aid, this kind of stuff, to be aware and watch for the signs, is also a really good way, because then in the moment, when you feel your heart rate start to rise, when you feel your respirations start to increase, when you feel your blood pressure going up, you can think, this is happening because it's a stressful event, but I'm fine. I'm okay. I can get through this. So knowing how to recognize the signs of stress and the signs of that fight or flight response, and being able to recognize them and change them, is really important and protective. So that awareness, pre-plan, protocols, practice, teamwork, those kinds of things. And I have protocols written on my little note sheet. And while, yes, with agencies, that's important protocols, but even with your caving group, that's important. So the people that you're familiar caving with, you should know that nobody leaves the parking lot until everybody's back at the cars. We always call my mother for our call out. Here's her number. That way, if something happens, we all know who to call and who to check in with if we're running late. The procedure for the most experienced person descends the pit first, and the second most experienced person descends the pit last. So those kind of things that you do regularly, then you don't have to think about it in the moment. My husband and I have a stressful event every time we try and figure out where we're going to go for dinner. So I started probably 2 years ago just saying, I want to go eat Thai. Anytime we ask, I'm going to say Thai food. And you know what? We have so many fewer fights and so much less stress over where to go eat. Also, he asks me less because I always have a plan. So the next part is attitude is everything. With in the moment stuff and preventing injury in the moment, it really comes down to your attitude. So that's where that resiliency training, that recognizing things that you can control, recognizing the signs of stress in yourself, calming yourself down, those are things you can do. So we can affect our patient and ourselves when it comes to changing our attitude, stopping negative thoughts, being calm and reassuring. And I know that the podcast that Gretchen actually recommended I listen to, and I have the citation for that at the end, or the credit to that at the end. It's from the Sharp Edge, which is the American Alpine Club. It's the podcast that they do with Ashley, and she had a psychiatric nurse or psychological nurse on her show and was talking about her little acronym for safety, calm, reestablish efficacy, which really means empower people, and connect and hope. And I looked at those and thought, that doesn't make a word to me. So I like race, and that's reassure. When you get on site with your patient, when you get on site with someone who's stressed out on your team, even when you're talking to yourself, reassure them. We're okay. You're safe. We're here now. We're on the road to recovery. The right people are here. We're doing the right things. We can do this. We are trained. I know how to give a presentation on Zoom. I'm probably not going to bomb too bad. And these people are really nice. They'll forgive me, even if I do. Attitude. So stay calm. Calm down. Be confident in your demeanor. Be determined. We can do this. We're going to get out of here. Hopeful. I am so excited that we are on our way to the exit. What are we going to do for dinner? I saw a meme that said, the sign of a hopeful society is people planning where they're going to eat after we get out of quarantine. I thought that was pretty funny. Talking about dinner is a great thing. Remembering that things are transmissible. So if you are anxious and upset, excuse me, then it's more likely that's going to transmit to your patient or to the rest of your team. So if you are calm and cool and collected, that will also transfer to your team. So that really makes a big difference. And then connections, so that's the RAC. So connections, so developing a good rapport with your teammates, developing a good rapport with your patient, making those connections with other people. So not just in that moment, but when you get out of whatever situation it is, calling your significant other and just saying, oh, I needed to hear your voice. I'm okay. You won't believe what happened, but I'm okay. You know, making those connections, speaking with people that you are not only familiar but comfortable with, helps to release positive endorphins in the body. It reminds you that you can be happy, and good camaraderie, good teamwork is one of the number one things in the moment that can help protect against psychological injury. And then empathy and compassion. So being empathetic, compassionate towards not only your team members, not only your patient, but also for yourself is part of that resiliency training that I was talking about earlier. Being able to, be nice to yourself too, is important. And then the E for race would be empower. So giving people the opportunity to take back control. So anytime there's a disaster, most people feel like there's a loss of control, and being able to give people back that sense of control is important. That can be something as simple as if you have a calm, coherent, cooperative patient who is able to protect their face while they're going through a passage, letting them protect their own face is very empowering. Giving them the option to decide, do you want your hands tied in or do you want your hands let go? Do you want to wear your helmet or do you want me to take it off in the event that it's, a good location or a good opportunity for that? Of course, don't let them do anything that is unsafe or going to hurt them. But if they have the ability to make a decision, give them the ability to do so, empower them to do so. And that's something that leadership can do, especially when working with a big team, is empowering your individual teams to make their own decisions. Try not to micromanage. Some of the stuff that we can't affect is our proximity to the event. So if you're the one that falls, you can't control how close you are. That was an accident. You didn't mean it to happen. You're kind of just stuck there. The rest of it, you can have power over. The type of event we respond to, that's something that we have no control over, barring we're volunteers. So you, of course, don't have to respond if you're a volunteer. If you're a career firefighter, you're probably going to have a little less flexibility on that one. But the severity of the injury, whether we're on a rescue or a recovery, that kind of stuff, we may not have the ability or the flexibility to control or to change. But the rest of the stuff, we do have an opportunity to change. We do have an opportunity to have an effect on. Attitude is everything is one of my favorite sayings, and my teenager, I guess he's 20 now, he's not a teenager, absolutely hates that phrase because it was one of my key ones all the time. I really like teamwork makes the dream work. This has to do with that rapport and camaraderie with your group, with your patient. It can make or break whether an event is stressful and you receive psychological injury from it, or if it's not. Misery loves company. Doesn't matter how bad a situation is. If I'm doing it with my girlfriends, buddy, I will clean horse poop out of stalls in the rain and in an ice storm and be freezing cold and have the best time. But if I'm with a bunch of people that I don't enjoy being around, it's pretty damn miserable and I sure don't like it. So that really plays into that. Low perception of safety goes back to that whole teamwork, trusting the people that you're working with. The higher you perceive your risk, the higher your risk of a stress injury. Lack of information can contribute to this, which is why communication is such an important part of teamwork. If you don't have good information, you're not getting clear communication, you're going to lose faith in your leadership, you're going to lose faith in the decisions the rest of the team is making. And that goes for your patient too. So be communicative with your patient. If they are awake and able to communicate with you, they're going to have questions. Knowing what to expect coming up is going to really affect them and have an impact on whether or not they are comfortable with the situation. If you know what to expect, it's a whole lot easier to face it than if you're going into the unknown. Let's see. Some of the things that we may or may not have a whole lot of control over are our duration of time in an event or in a situation. So the people that arrive first and leave last, which is pretty common during cave rescues, they're at a higher risk. If they're in demanding circumstances, so if you're, in a tight crawlway and you are dragging that patient for a long period of time and it's just miserable, the longer you're doing that, the higher your risk that it's going to have an impact on you. Not getting any breaks, not getting any rest. Those things are important, and that's where leadership can really step in and make sure that they're rotating people out well, that they're not letting people stay in the trenches, especially if they have a full staging area. But also that's when you can advocate for yourself and advocate for your team members. So that ability to self-check and know when you've reached your limit and speak up when you get there. Check in with your friends. I know you were talking about the buddy system. During Bonnie's talk, y'all mentioned it, working in pairs, having a buddy system, but that works with this too. So have somebody that you know well enough that when they start having the hanger pains and they start getting grumpy, you can advocate for them. Hey, they need a break. They need to go eat, because all those things can increase your risk of a stress injury. Let's see, putting the welfare of your team, above all else is really important. I know that during our NCRC classes, we talk about how I'm number one. This is the number one person I'm going to look out for. And my team, they're number two. So I'm looking out for myself and I'm looking out for my teammates. That also goes with they're looking out for themselves and they're looking out for me. Because if we can't trust each other to keep an eye out, that puts us at an increased risk of all sorts of things. Not just stress injuries, but if you're hungry and you're thirsty and you're not getting your basic needs addressed, you're not going to be a very effective rescuer for very long. And then your patients, number three. Remember, they were already hurt. They got you into that mess. So while it is super important to take care of them, it's more important to keep it to only one patient. Let's see. I also want to point out that ICS is a great way to make sure that you have dedicated teams, excuse me, that have a clear job, a clear designation, clear expectations, and an ability to work within a frame that's not only established, but has good span of control, which allows better communication and better reassignment, all sorts of things. So if you haven't taken an ICS class, I'll also recommend that one. We touch on that during our NCRC classes too, but you can find free online ICS classes. I think 100, 200, and 700 maybe, which are not difficult, but they talk about the ICS structure, and it's a great class to take. So recognizing good work and small successes, that just goes back to good teamwork. It's amazing to me how much of this stuff all comes down to be prepared before you go with a team of people that you know and trust, know what you're doing, and communicate well while you're there. And those are the things that you can do to best prevent stress injuries in the event that you're in a rescue situation. And it's so similar for the patient, for the rescuers, And gosh, it just translates all over everything. I was thinking about this with Glenn earlier. That's my husband. In our pop culture references, thinking about resiliency training and that ability to stop yourself in the moment, reframe your thinking from negative thoughts to positive thoughts, and channel those positive energies. And it made me think about Harry Potter and what it takes to conjure a Patronus. I don't know if anybody's as big a Harry Potter nerd as I am. It's difficult to be that big of a Harry Potter nerd, but that thinking a happy thought, think of when you were happiest, go to your happy place, stop those stressful thoughts in the moment, reframe your state of mind, change your attitude. I just think that that's really cool. It just shows how common it is through all of our culture. So after an event, what do we do if we notice signs of any sort of stress injury or psychiatric injury? We mentioned earlier what those signs were. Do y'all remember them? Can you give us a refresher, Gretchen? Anybody out there want to chime in? Remind us what those personality changes are.
So anxiety, short temper, thank you for withdrawal, eating changes, watching lots of Netflix. They listen to you. Lack of motivation.
So this comes back to that buddy system thing. You may not notice if it is happening to you. But again, if your best friend starts asking you, why don't you ever want to go out anymore? Or why don't you want to go caving anymore? Or why don't you want to go eat Thai with me anymore? If you start withdrawing, or your friends say, you just seem really grumpy lately. What's going on? Those are clues. Checking in with your buddy, especially if you have that buddy system on a rescue, if they're not somebody from home, swap numbers, check in with them afterwards as well, because a lot of those things show up later, and it takes somebody else calling attention to it for you to recognize that perhaps it's a change and perhaps it needs addressing. That avoidance doesn't have to be alcohol, doesn't have to be substance, doesn't have to be TV. It can be my number one avoidance tactic, which is overcommitting in all sorts of ways so that you don't actually have to face the problem. Sleep disturbances, lack of motivation, all those sorts of things. This can actually be made worse if you have to see a bunch of armchair quarterbacks talking about a rescue and telling you what you could have done differently and what you should have done differently. So media critique can actually have a big effect. And I just want to point out that that's one reason why we don't want to, quarterback things on Facebook. When you see a report of a rescue, just think happy thoughts and send them positive energy, and don't talk about what could have been done differently. Those people are under a lot of stress, and trust me, if you've been in that situation, I'm sure you know that you are already thinking about the millions of things you would have done differently or could have done better. You don't need anybody else pointing it out to you. That just adds insult to injury and makes it worse. The media can actually exacerbate that. I know that I felt that way with the news cycle over politics this past couple of months. Caused me a stress injury. Let's see, avoidance coping is not just avoiding other people or avoiding thinking about it. It is deliberate avoidance. So people that absolutely refuse to discuss whatever it was that happened, people that absolutely refuse to confront the problem, that's actually a really big indicator that there's some injury there, and they probably need to go through some more intense counseling kind of stuff and actually face that. Organizationally, we hear a lot about critical incident stress debriefs, and while those can be super beneficial to some people, it's like the media thing. If you hear about critical stuff or you hear about reliving it all again, it may not be beneficial to you. So they're now recommending that those are not mandatory. It's great that they're offered. It's not great if they're mandatory. Counseling opportunities, some rescue teams, if you're part of a rescue team, or if you're on a big incident, one of the teams will, offer counseling opportunities. But that's something that we can all seek on our own as well. If you have financial limitations, there are resources out there to get help without having to incur financial hardship. And I have a couple of resources at the end of our presentation, but there's a big movement for, I think, responderstrong.org, and for some online counseling resources for first responders and people that are involved in stressful incidents like that. Other thing that's important to resolve to help prevent any sort of stress injury, or actually it pretty much goes to helping make sure that things are at a better state before you get into another situation, is resolving any conflict that happened during the incident. So if you're a team leader and you had two of your team members that had a throwdown in the middle of the cave because one person skinned a cat one way and the other person wanted to skin it the other way, that's where you need to revisit those policies and protocols and resolve those conflicts between team members, because you want to reestablish that camaraderie and that sense of teamwork before you have to respond again. It also, revisit as management or as leadership all the stuff that you would normally talk about in a critical incident stress debrief. Revisit all the things that happen and make sure that all your policies and protocols are adequate and that people are familiar with them. So pre-planning that, revisiting all those, anytime that you have an incident, it's a good time to just review that kind of stuff. And then remember those long-term effects. The faster you start to address any signs of stress injury, the easier it is to get those resolved. Otherwise, they tend to set up shop and stay for a long time. And I also thought this was a neat one, a neat statistic. This was an indicator from the military for PTSD and suicide, increased risk of suicide. If you watch TV for over 4 hours a day, a month after the incident, you have like a 30% increased risk of having a lasting stress injury. So I thought that was a neat number. I don't know if it's as applicable right now when we're all limited in what we can do, but if you didn't watch 4 hours of TV before, it may be a good indicator. So I would like for everybody to take just a moment and think about the last time you were in a super stressful situation. So while you're taking a minute to think about it, I have had a really tough year. So once COVID and lockdown started, I immediately got on the works to go to New York and help, because that's what I do, right? That's what a lot of us do. If we have the opportunity to help when someone else is in crisis, we do that. I got back from that and was further traumatized by the callousness with which people in Georgia were treating the COVID crisis as compared to the people in New York. Everybody up there was wearing masks. Everybody up there was hand washing. Everybody was taking it very seriously. Also, all of my patients died. Everyone died. Not on my watch. In fact, I only had one patient die on my shift, but we saw 2 people that got moved from the ICU where I was working out of the hospital. And I don't think any of them went home from the acute care facilities, long-term acute care that they went to. So it was pretty traumatic. But then I got back to Georgia and nobody seemed to give a hoot about any of that stuff. And walking through the airport, having someone walk up behind me and cough on me pretty much sent me into a panic attack, which is not like me. I'm pretty not panicky. So this is me. So that was pretty traumatic to me. And then I had another really stressful incident in September. And then I went back into the COVID ICUs just a month or so ago to do another 3 weeks in my home in Rome. So I think it's very timely that I had the opportunity to study about all this stuff and remind myself of all of these things. So thank you again for the opportunity. I apparently really needed it. But I think that it's good that all of us recognize that we probably all been through some of these incidents. If you feel like sharing, go ahead and throw, a little synopsis of your incident, or, when it was, something about it in the chat. I just want to get everybody in the idea that this is not unusual. This is really common. Stressful incidents that cause stress injury, psychological trauma, it doesn't have to be severe to be important. And while y'all are doing that, I'm going to tell you a story about my husband, Glenn. So my husband, Glenn, his traumatic incident that really caused personality changes in him that I could see happened September of 2019. We were down in Fort Lauderdale, and he had a traumatic electric scooter accident, which won him a titanium plate in his collarbone and 9 screws. It's not his character to be anxious about falling or getting hurt, but somebody who grew up skateboarding and caving and climbing and doing all sorts of adventure sports, all of a sudden didn't want to go hiking with me, didn't want to go caving with me, didn't want to go ride bikes with me. And he's just now starting to recover from that enough that he's recognizing that he's not at risk of falling every time he goes out, that, being realistic about expectations, and starting to venture into some of those adventure sports again. However, at the age of almost 50, deciding that he doesn't want to ride scooters again and changing his hobby preferences may be age appropriate. So just because your hobbies change from before an accident to after an accident doesn't mean that that is the be all end all. You're going to have PTSD. What that does mean is that this is a protective mechanism that our brain has to keep us safe. And when your body perceives danger, there's a reason it registers something is dangerous and you don't want to do it again. It's because it's protective. So do cut yourself some slack. Don't think that you've had a traumatic event. You've got to get right back on that horse and go back at it, because you don't. As we grow and we mature, we can make decisions about what we're going to do. So Gretchen, I'm not going to ask you to share all of those stories, because I know we're running short on time, but have we had some people chime in with some instances where they've had a traumatic event that has left them affected?
Yes. So Michael shares that I had a call a few years ago where a 5-year-old was shot and killed. During the call, a person on scene was walking through the house with a pistol, not the shooter. The police department cleared the scene prior to our arrival. I was upset that my crew was in this tight spot. I worked with our chaplain to talk it out.
Yeah, that's a great example. I'm sorry that happened.
Yeah, that's a rough one. Kimberly shares, I recently dislocated my knee in a crawlway, slightly tore a ligament. I'm a bit nervous to try a crawlway again. Would that be a trauma or stress response?
If it triggers the increased heart rate and the increased respiratory rate, the increased blood pressure, those other things, when you start to think about it or you start to get into it, yeah, that can have some stress injury related to it. It can also be that you may be realizing some of your limitations, and it is perfectly normal and natural for you not to want to re-injure yourself. So give yourself some grace. I'm not saying don't ever do it again, but I am saying that recognize that some of that may just be in your head, not necessarily in your knee. I don't know if it's to the point that you want to look at, getting some other support and counseling about that, or talking about your friend, about that with a friend. But when you go back into those underground situations, do all of those things that we talked about, pre-planning, having a strategy to calm yourself down when you get underground and you realize that, oh, we're going to have to crawl, go ahead and plan ahead how you're going to address that. It is very possible to calm yourself down in the moment, as long as you have strategies and practice it. It sounds silly, but, talking to yourself in the mirror actually works.
And my Zoom cut out, so I lost my chat. So Sarah, could you read? I think there was another one below that.
Yeah. So Emily shares when we were rescuing an entrapment incident in a very tight cave, no one over 36-inch chest. The fact that we could not get him out for over 48 hours spooked me for months.
And my guess is if you start thinking about it for a long time, it still has the potential to come back and haunt you. And I'm really sorry about that. It's a really tough situation, and very natural and normal for you to have been upset about that and for it to have left an impression on you. So yeah, I'm sorry. So these are just 3 examples. At some point, if you play outside long enough, you're going to have one of these incidents. It may involve an injury. It may not involve any injury at all. Sometimes my little brain gets to creating scenarios in my head, and I can sit on a ledge and think about falling off of it long enough to freak myself out and decide that, maybe I do want a hand line. And, recognizing that in myself, because I have a tendency towards anxiety, which has gotten worse lately, it is important. So I'm going to share some resources for that resiliency training, psychological first aid training, personal counseling, all of these things. A Google search of counselors in your area, a Google search for resiliency training. That's where I got these resources. You can totally do that for yourself. If you have trouble getting hooked in with any of them, let me know. I'm happy to help you out. Peer support training is an accredited program. They're starting to do this more and more, like rescuer to rescuer peer support. It started a lot with substance abusers and alcoholics, and peer support through like AA and having a sponsor and a mentor. But it's an actual accredited program, so it's a class you take to be able to offer support in a positive way, to be able to have good effect. When you do online or phone counseling or even face-to-face peer counseling with somebody, if you're interested in that, I highly recommend it. And then the National Suicide Prevention Lifeline is a crisis lifeline that is open to anybody. It is staffed and manned 24 hours a day, 7 days a week. If you don't feel like talking to somebody on the phone, you can text them or chat with them at suicidepreventionlifeline.org. One of the people closest to me committed suicide back in September, and it is probably the thing that has rocked me most ever. I've never been so affected by an event that I had, absolutely no control over. And personally, I like to be in control. I like to have my pulse on things, and overcoming that, and I'm still not there, is taking a long time. My husband and I sold our house, and we are currently staying on a boat in coastal Georgia. I've worked for those 3 weeks that I went back to the ICU. It's the most I've worked in 3 months, and I still spend probably 1 day a week just sort of in tears and shambles. Yes, I am getting help, but it is super impactful. And so please know that, if you are having trouble dealing with something, you are not alone, and it is understandable. So a big shout out to some of the resources that I used. I really want to call attention to the first resource up there, Mental Health Response to Acute Stress Following Wilderness Disaster, by our own caver, Amanda Mortimer. She's been a longtime caver and a longtime participant in NCRC. She teaches psych stuff out in California. She is an excellent teacher. And I was researching and looking for resources, and I looked up and I thought, man, this paper has everything I need. And boom, it was Amanda's. And I just thought that was awesome. Some other things that I really enjoyed was the Psychological First Aid by the Sharp End podcast. It was episode 34. So I recommend you check that out. It's about 45 minutes. You can listen to it while you're driving home one day. It's great. These are some other ones that I looked at. So please don't hesitate to Google search, find some other stuff to look through. Take a psychological first aid class, take resiliency training. The more we prepare for injury, the less likely we are to incur it. So thank y'all so much. I really appreciate the opportunity to get to talk to everybody. If you have any questions, I know that we're right up to time. I went a little bit long, but I am happy to stay for a little bit and answer any questions that you may have. If you want to email me, I'm going to stop sharing. If you want to email me, my email address is RebeccaMland@gmail.com. So I'm going to throw that in the chat. Feel free to drop me a note or an email. Just recognize that I'm currently living on a boat, may not get back to you quite so soon. So give me a couple of days. But again, thank you so much. This topic is near and dear to my heart, more so now than ever. So thank you, Gretchen. Thank you, Sarah. And thanks, everybody.